Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today's Incident Command Day 51, giving you the update from Albany Medical Center on the coronavirus. In the 5 counties, we now have 2,178 people who have tested positive for COVID-19 in the 5 surrounding counties. Inside here in the medical center, we currently have 55 patients that we're currently treating for COVID-19. We have 35 on the floor. We have 20 in the ICU. And Fred, we only have 6 on ventilators right now.
That's right. Low water mark. That's great.
That's great news. We had mentioned that we were going to talk a little bit about flu data. The influenza season has pretty much come to an end. It usually crosses over, so in this case from 2019 to 2020. And the numbers are the following. In those same 5 counties where I just reported 2,178 people who have tested positive for COVID-19, in those same 5 counties, we've had 6,500 people during that last year who tested positive for flu. Obviously, it's very difficult sometimes to compare one number with the other. We're not comparing mortality rates, but it gives you some idea how many had the flu.
That's right. So about 3 times as many people had the flu as have been diagnosed with COVID now. And those tend to be more symptomatic patients with the flu because they've actually been tested.
We can't speak about the mortality rate with the flu. That's not data which has been reported up to the Department of Health yet, but if that information comes in later, we'll share that here.
Absolutely.
All right. Fred, you mentioned last week that you were going to listen to a virtual town hall that was being put on by the University at Albany on the crisis related to COVID-19 by doctors from Wuhan, China. And I think you listened to it last night.
Yes, Dennis, it was actually very interesting. So 3 physicians, 1 ED doc, and 2 ED/critical care physicians, actually from Shanghai, who went to Wuhan to work with the docs at Wuhan and treat patients there, spoke to us by a webinar that was put on by UAlbany School of Public Health. And it was very interesting. They underscored a lot of things we know about this disease in terms of how people do with it, some of the side effects or complications that occur, like thrombosis that can happen. But they talked about 3 interesting points that I appreciated one but not the other 2. So they talked about 3 groups of patients that actually didn't do very badly with the virus, actually seemed to do pretty well with it. So the first was children, and we've heard that, and we've actually seen
which
that
is great
here.
news.
It's absolutely great news. But the second was pregnant women. In their experience, pregnant women did very well with this virus, did not have a lot of complications, did not get very sick. And the third was even more interesting to me, which was patients over the age of 90 seemed to do well, better than those in the 60s and 70s. And we were speculating about why that might be. Perhaps their immune response isn't as vigorous, so they don't get that inflammatory reaction that seems to be very troubling. So it was fantastic. We asked questions about surgical cases. There was some information about that, and a few other questions that they were able to answer for us. It was good.
I'm glad you listened, and it goes back to what we talked about before. We're an academic medical center. We always want to learn, and I appreciate you listening in on that.
It was a very, very good session.
Now, you mentioned OB. You mentioned pregnant women, and OBGYN is an area that you are representing today.
I'm representing OB, so I have a scrub top from our OB service provided by Dr. Kiley, Kevin Kiley, and we're going to do a little shout out to Dr. Kiley. Dr. Kiley's had a lustrous career in the service, was Surgeon General of the Army. Then came here and had an illustrious career as chair of OB. Came back after retiring to help us out just about a year ago.
Yes.
But is going to be leaving, I think, this Friday. So
should we salute him?
Let's salute him.
Let's salute him. I think my salute was probably better.
Yeah, it was definitely better than mine.
But we recognize OBGYN, the doctors, the nurses, and OB anesthesia. And it's a very special population that we're caring for with COVID-19 in this environment in a safe way.
It is. And it's a population that hasn't really changed in terms of volume. So obviously people got pregnant 9 months ago, so they can't really alter their deliveries. And so it's been relatively busy in the OB service.
So thank you to all of them. And today I'm representing the Department of Physical Therapy, which has various areas in it. physical therapy, occupational therapy, and the communication disorders group, and of course Albany Med Fitness, which is an area where they've done some videos. But Fred, physical therapy is increasingly important for patients with COVID-19. We've learned that when they come off the ventilator, often they're significantly debilitated and need significant help.
So some of these patients are, elderly in their 60s and 70s, and even 3 or 4 or 5 days of bed rest, they can get deconditioned pretty significantly. So some of those patients on the ventilator have been on a ventilator for 10 days, at bed rest for that many more days, 15 or more. So rehab is very, very important. Physical therapy, getting them moving again, back on their feet, is very important.
So on the journey to recovery, physical therapy, another part of our workforce that does an incredible job on taking people all the way out the door to full recovery. So we thank all of them as well. One final topic, Fred, is healthcare workers who've tested positive for COVID-19. We'd like to update people what the status of that is right now.
We do keep reporting on this. So we now have 92 healthcare workers that have been tested positive out of over 900 that we've tested. So that number has stayed about the same. About 10% of the workforce that we test have tested positive. But I can tell you that 64 of the 92 are back at work. So they've gone through their illness, recovered, and have been able to come back. And that percentage has stayed about the same as well. So all good.
What wonderful news. The governor today in his press conference spoke again about elective procedures or non-elective cases. I think we'll probably talk some more about that tomorrow. So this is normally when I do my closing. And
Yes.
Fred, I was watching the news last night, and there's a national news anchor who I think says the same thing I say.
So actually, Dennis, I think he started saying it after you started saying it.
I think he did too.
Because that's the news program I watch every night. And Mary Ellen, my wife, said, "Isn't that what Dennis says on the video?" And
well, he can keep saying it, but I'm going to keep saying it too.
Right?
I'm going to keep saying it too.
There you go.
Because it's an important message. So we'll be back again tomorrow. We ask that you please take care of yourself, take care of each other, and we'll see you tomorrow.